Yeah, you can speak for everybody.
So we started visiting Dr. Finke about 2 years ago, year and a half to 2 years ago. My wife started first, but she has had chronic back pain and other things that we've dealt with over the last few years, and we've got to a point where we had visited some chiropractors but never done a couple different things, but never been on a more disciplined regimen to see results or, you know, stick with it enough. So we got to the point where we said we're not going to pursue any surgical things for Jessica.
I was at the point where I said, you know, I've got to do something. I've tried chiropractic care. I'm in constant pain. I think I need surgery. That's where I was.
So before we went that route, we said let's look at something that's less invasive with Dr. Matt. But I don't know what happened first. But in the midst of that, I had a terrible accident and was working on my house and fell off a ladder almost 30 feet. And so I destroyed my arm. I crushed my pelvis, buckled my sacrum, broke vertebrae, ribs. I mean, was in a hospital bed in wheelchair for 3 months, you know. So you can obviously imagine the trauma caused all sorts of issues, but then being, you know, not able to bear weight for 3 months, I was basically stiff and everything atrophied and just locked up. So we came at basically, I think you started before me, but then shortly after Jessica started, I started visiting Matt just to start trying to get some motion because I had been immobile for so long and basically just sedentary, you know. And so with myself, Matt worked on just trying to get my spine moving again, because literally, well, my neck but I mean everything was cockeyed. Like my pelvis is slightly disformed now, but my hips were dramatically off. Everything was just cockeyed and not working right, and I was just stiff, so I couldn't really get the flexibility. So over about a year's time, we just continued to get more freedom and range of motion and get me able to twist again. And you can obviously imagine I had a lot of discomfort and pain from the accident, but then later on top of that, the stiffness and the rigidity of my spine. So I'll never forget, about 6 months into the treatment, he adjusted me, and all of a sudden it was like I just got that full twist of my torso again, and it was like a light switch going on. And so we've continued. I'd say it's a journey, like you said. I mean, we've come a long ways. I'm in extraordinarily better health than I was even 6 months ago, and I was on disability for about 6 months, and so I've been back to work for a little over a year now. And people ask me, are you at 100%? And I keep thinking I'm at 100%, but every month I am a little bit better than I was last month. So you know, I think just sticking with obviously other therapies, but in addition, continue to focus on getting better, you know, spinal health has been critical. And when we did my side-by-side x-rays from when I started to a year later, it was a pretty dramatic story. So I mean, just how much my hips were cockeyed and my spine was out. I mean, for the most part, we had seen a huge level of improvement and are just working on now what I would call were probably existing issues before my accident. So so that's me. And then Jessica, you know, for her, I'm a little bit selfish because I would probably spend, you know, 15 minutes every night rubbing her back, you know, because she would literally be at the point of tears and say, I need relief and pressure. And So I'm in the bed rubbing her back, and that is, by my barometer, is much less now. But I'll let her say. So from a selfish standpoint, Dr. Matt's relieved me of my nightly chore of rubbing the back.
You did want to touch me, honey.